Are we ready to go? All right, I guess we're starting. Bon, ben, bonsoir et une chaleureuse bienvenue à notre webinaire sur les soins dentaires. La soirée se déroulera en anglais, mais nous pourrons prendre des questions en français. So good evening and a warm welcome to everybody to this session on dental care. Sorry for the informal start there. The session is entitled Healthcare with Teeth, Part 2, courtesy of my colleague Tracy Glynn, who has a way with words. My name's Anne Lagacé Dowson. I'm the communications person at the Canadian Health Coalition. And I'm speaking to you from the traditional territory of the Haudenosaunee, or the Six Nations. I'm in Jojage, which is Montreal in Mohawk. And with us tonight, we have two wonderful and upstanding Canadians, Dr. Brandon Doucet, who practices dentistry in Halifax and has been called the Tommy Douglas of dental care. I think we called him that, actually. Did we give you that title, Brandon? And he has a new book, which has just come out, called About Canada Dental Care, detailing how business interests blocked access to dental care and why teeth were excluded from Canada's universal health care program. And also with us is Don Davies, who is a labor lawyer, worked for the Teamsters before being elected for the NDP in Vancouver Kingsway in 2008. He's the longest serving MP in his riding, having won 4 times. Among his many duties, he is the NDP's health critic and a great ally of healthcare. So this story, the dental care story, is a good news story against a backdrop of many bad news stories in the healthcare sector. So it's a great pleasure to be able to talk about some good news on the healthcare front. And I'm going to let Brandon describe the details of the dental care program. But I wanted to start out by saying that for a lot of us, dental care has been very difficult to access. My father grew up in the 30s. He ended up with a full mouth of dentures. His teeth were all pulled out, like many working class people across Canada. And when we went to the dentist, we went to the dental school at the University of Toronto to be experimented upon by the students. Some of your colleagues, Brandon. So I wanted to ask you, Brandon, to give us the background on dental care. Why wasn't it included? What went on when healthcare became a thing in the 60s?
Absolutely. So dental care wasn't included in our universal healthcare system for several reasons. One of them being that basically it was a big fight to actually get universal healthcare for physician services implemented. I mean, we remember doctors went on strike. There was a lot of upheaval within society, and there was a tactical decision made to basically implement universal healthcare for physician services now and come back to implement coverage for things like dental care, prescription drugs, eyeglasses at a later date. And obviously, we see that this hasn't happened, and we see many problems relating to this. So we're looking at over half a century later, over 1 in 3 Canadians lack any form of dental insurance. And we also see that over 1 in 5 avoid the dentist each year because of financial constraints. Kind of talking more about where we are now, these are actually numbers that have been rising because work's becoming more precarious and fewer people are getting benefits like dental insurance tied to their labor. We're also seeing many elderly people retire and lose that work-related benefit. On top of this, the cost of dental care has been rising more than inflation for decades. So in response to the increasing struggles people have been facing in accessing dental care, we've actually seen public dental spending decrease as a share of total dental spending. So in the 1980s, if we're looking back, public dental spending accounted for around 20% of overall dental spending. And now public dental spending only accounts for about 6% of dental spending. In this time, we've seen the existing programs get eroded. So, programs that once covered all children now only cover low-income children. And coverage has been cut back in many instances to only cover emergency procedures. And the fees the programs pay out have often been de-indexed from inflation, leading to people who rely on these programs to struggle to find a dentist who will accept them. And when we're comparing ourselves to other developed countries in the OECD, Canada actually ranks second last as a share of public dental spending as a share of total dental spending, which is usually a good marker for the inequalities in access to dental care in a country. So with 6% of dental spending in Canada coming from government programs, we even rank behind the Americans, which is a pretty low bar. Yeah. We
Yeah.
like to be
So
smug.
Brandon, like you're a working dentist. So people come into your office with all kinds of conditions, right? So tell me, like, what are you seeing in terms of your practice? The people who come in and you treat, like, because dental care isn't just teeth, it's also general health that you're seeing, right? You're seeing different kinds of lesions and all kinds of stuff in people's mouths, right?
Absolutely. So there's different ways of looking at access to dental care. I had a patient recently, actually, whose story I think reflects the desperate need for universal dental care in Canada. This individual actually had an asymptomatic lesion on their tongue that I noticed during an appointment where they needed all of their teeth taken out. So obviously, this is someone who was not able to access dental care through much of their life because things have festered to this point. And because I saw this lesion, I decided to send them to a specialist for a biopsy. And it turned out that this lesion was actually a malignant cancer. Despite this patient not feeling pain from this lesion, the disease actually progressed to a pretty late stage where the 5 year survival rate is actually around 30%. So very devastating. And I can't help but think that if this person was able to access dental care throughout their lives, which was clearly needed, that they would have been able to pick up on this lesion sooner. And if you do pick up on this lesion sooner, the 5 year survival rate goes from 30% to 90%. So a very big difference in this person possibly being able to survive. And I think that it's really important that we look at these instances and be able to, contextualize the urgency with which we need to deal with these problems because dental care absolutely is healthcare. We see many ways that our oral health overlaps with our overall health. It's been shown that poor oral health can cause or worsen many general health conditions like diabetes, heart disease, having a low birth weight infant, aspiration pneumonia, erectile dysfunction, osteoporosis, metabolic syndrome, stroke, there's many other ones as well. And there's also other ways of looking at how dental lack of access to dental care affects our society because when people can't afford to go to the dentist, many of them end up in emergency departments from dental pain. So 1% of all emergency room visits in Canada are for people with non-traumatic dental pain, which costs taxpayers about $150 million per year. And the emergency department is not equipped to deal with these problems as patients are usually given an antibiotic and pain medication and told to go see a dentist. As a dentist who works mainly in a federal prison, I'm seeing people regularly who have never been able to access dental care in their lives. I'm spending all day basically dealing with pain and infection, people's faces swollen out. And it's pretty shocking. These are people who often don't make it to private practice dental clinics. So, as I've worked in private practice, I've seen many things as well. But, working in a federal prison, I'm kind of seeing these things on hyper speed. I graduated about 4 years ago, and I've seen, more than probably a couple dozen people who have tried to extract their own teeth because they were unable to go to a dentist. And, I'm tired of seeing those cases. I don't want to see those cases anymore. I do think there's hope with the Canadian Dental Care Plan that we can start to make some progress on this issue, which is desperately needed. There's so many ways in which access to dental care impacts people. Anyone who's had a toothache understands how miserable this is. These things, when we just treat these things in a band-aid fashion, like when people go to the emergency department for dental pain, it is really dangerous. A dental abscess is a localized infection. It's caused by basically a cavity hitting the nerve in the tooth and eventually leading to an infection in the bone underneath and pus building up and stuff like that. That localized infection can spread and lead to potentially life-threatening complications. An infection of an upper tooth can spread to the brain, and an infection of a lower tooth can cause swelling that can compress the airway. So all of these factors means that increasing access to dental care and improving the oral health of the population, it's beneficial to the individuals that receive care, but also to the broader society, in this fact that, you know, we're going to reduce strain on our healthcare system because people are going to be healthier. People are going to be less likely to get trapped in the cycle of poverty, because having missing teeth or visible dental decay is a visible marker of poverty and affects people's employability. So, you know, ensuring access to dental care is really an opportunity to give people a chance at living a dignified quality of life.
That's some gruesome stuff there, Brandon. My goodness, and quite disturbing. I knew it was serious, but that's pretty dire. So thank you for that firsthand account. I'm wondering if we can go to Don now for some of the political backdrop of the dental care good news story, even though perhaps it's not as far reaching or as wide ranging or as universal as we'd like. But I just wanted to mention, for those who want to ask a question, Tracy, should people go into the Q&A or should they go into the chat to ask a question of our panelists?
They should use the Q&A.
Okay, so those of you who are watching with us and participating, please do forward any questions you might have, and we'll do our best to try and address them. Okay, so Don Davies, tell us a little bit about how this happened. How did dental care that we have now and that will be expanding shortly, how did it happen on the Hill? Give us the political sort of snapshot.
Sure. Well, it's great to be with you, Anne and Tracy and Brandon, and welcome to everybody who's participating tonight. Well, you know, the politics can really be traced back to the 1940s when Tommy Douglas was Premier of Saskatchewan and had a dream that people should have access to primary health care, not based on the size of their wallets or income, but as a matter of citizenship and right. He committed to the concept of head-to-toe healthcare, and the concept emerged then that we should be covering everything through our public healthcare system. And the reason I start there is because it gives, I think, our listeners a bit of a perspective on how long this unmet primary healthcare need has existed in Canada. You know, that's 80 years ago. Brandon touched on the 1960s when we had a minority government, ironically, 2 consecutive Liberal minority governments in the 60s, in 1963 and 1965, where the NDP held the balance of power. It's very similar to 2019, 2021. I'll come back to that. Tommy Douglas, who was leader of the Canada's New Democrats by that time, compelled the Liberal government of Pearson to commission a study and to force them to bring in Medicare. But before that, I believe it was Diefenbaker who commissioned Emmett Hall, who was a retired Supreme Court of Canada judge, to do a report on Medicare. And the Hall Commission, as it was called, actually recommended, much I think to conservative chagrin, that we go to a public healthcare system. And at that time, they were meant to include dental care. And my reading of history is that, in addition to the reasons Brandon touched on, was that the main reason that they didn't proceed with it, besides the political realities and numbers, was that it was thought that there were not enough dentists at that time who could deliver universal dental care. So now, you know, I've situated you in the 1960s. So now we're talking about a half century ago. Now, where, I guess, to give you the modern politics of it, this really started, I was named health critic after the 2015 election. And Jane Philpott was briefly the health minister, and then the Liberals appointed Jeanette Petitpas-Taylor. And she came to committee one day, and the Canadian Dental Association had just put out a report that stated, as Brandon pointed out, that about 32% of Canadians, that's 1 in 3, do not have any dental insurance. Now that's a staggering number of people when you think about it. You know, if there's 40 million Canadians, you're talking about, you know, 13 million Canadians walking the streets right now who, if they have a dental need, have to pay for it out of their own pocket. And we know how expensive dental care can be, so they just don't. I also want to pause there and say, of those people that don't have dental insurance, think of who they are. It's not the wealthy. 50% of people who don't have dental insurance are low income, and most seniors over 65 do not have dental care. So it's among the most marginal Canadians who don't have that. If you're wealthy, you probably do have access to dental care, even if you don't have a plan at work. So I decided with Jeanette Petitpas-Taylor when she came to Health Committee, when ministers come, they're always really prepared for what you're going to ask them. So I sort of strategized with my staff, and I said, I'm going to ask her first off. I'm going to put this statistic to her about 32% of Canadians not having dental care, and I supplemented it with some stark information, as Brad has pointed out, that dental care is primary health care, that it can lead to serious, untreated leads to serious conditions, as Brandon has pointed out, cardiac events, diabetes complications, premature birth, etc. And I said, given that this is, we're a G7 country, I asked Minister Petitpas-Taylor, did the federal government have any policy or plan to address this? And I caught her off guard, and she very honestly and candidly said no. She said they didn't have any policy on this. So leading from that, as health critic, I started getting to work to devise a plan for addressing this. I've always thought that dental care is as much a part of our healthcare system as anything else. I mean, you break an arm, you go to the hospital, it gets fixed. You break a tooth, what's the difference? We cover infections from the tonsils back. Why don't we cover them from the tonsils forward? It's like we cover our whole body and we carve out this section of our mouths and pretend that that's not part of our overall health. Worse, as Brandon has touched on, because it affects our face, because it involves intense pain, there's a mental health component and I think a self-esteem component. People are very self-conscious of their teeth, and we make judgments about it. So there's a class issue, very serious class issue. So the NDP got to work and we devised a plan. I'll state right now, our dream and my dream is for universal dental coverage through our public healthcare system for everybody. That's it's the fairest, most effective, most efficient way, in my view, to deliver all health services. That's mental health, that's auditory care, eye care, dental care, pharma care, in addition to what we already cover, which is physician care and hospital care. So we developed a plan to do that. We put together, we're the only party actually in 2019 that campaigned on a program to get started on this. And it was our program to say, well, let's get started by getting a down payment on this, by getting a plan together that at least will cover everybody who doesn't have coverage now. And so we put together that plan. And, we had a minority government. Again, now I'll pick you up from the 60s. Finally, the NDP has a balance of power in 2019, so we're going to force the Liberals to act on these things, which they never would do without us pressuring them. And COVID hit, basically in January, February of 2020. That threw everything right off. So we basically, the whole country was thrown into political disarray. But when 2021 happened, we had another election, and anybody who's following closely, we had almost an identical parliament. Like, uncannily, within a handful of seats either way, it was the same numbers. So this time we thought, under the leadership of Jagmeet Singh, we thought we're going to go to the Liberals with our 25 MPs out of 338, and we were going to use our balance of power to try to get things for Canadians. So we signed our confidence and supply agreement, where we forced the Liberals to agree to 27 different items that none of them they wanted to do. They are only doing it because we forced them to. And one of them, I would say the marquee piece, is to get started on dental care. So that's what we did. And in the confidence and supply agreement, we got them, we wanted it right away. But the best we could do is get it implemented in tiers. So the confidence and supply agreement calls for us to establish dental care for children under 12 by the end of 2022, and expanding this year to children under 18, seniors over 65, people with disabilities, and finally, by 2025, so in next year, everybody who meets two criteria. You have to have family income of under $90,000, and you can't have any dental insurance provided through an employer. So it's basically a plan for people without dental insurance, and it's means tested. Now, I don't like that, and I think we'll talk about that a little later, Anne, about that. But the reason that $90,000 was picked was that and there's no copays under $70,000, that was the median family income. And we consider this, as I said, a down payment on universality. So that's what we're implementing this year. where I'll conclude is saying that we signed this agreement in April of 2022. It was April of 2021, and we wanted to have it was April of 2022.
Yeah.
We wanted to have the coverage for children under 12 by the end of that year. That was basically 9 months. That proved to be a little too fast. So that's why we improvised and we brought in an interim benefit where parents of children under 12 would qualify for 2 payments of $650 each, one for the period from November 1 of 2022 to June 30th of this year, and then another $650 from July 1 on. So a total of $1,300 per child under 12 as a purely temporary measure while we fix and get the actual dental care plan, which I'm happy to report is well underway. I had a briefing last week with Minister Holland from Health Canada, and I got to tell you as well, I don't want to sound like we're crowing about this, but we have driven every single bit of this forward. I mean, the Liberals, quite honestly, when I put this to Minister Duclos when he was first appointed, he told me, he said, candidly, Don, he said, the Liberal Party has no policy on dental care and neither does Health Canada. I told him that's fine. The NDP has lots of policy and we'll be happy to work together. So we have driven everything forward. And the bottom line, and where I'll conclude, is this. What we want is a great plan that has broad normative services, just like any normal dental care plan. We want it to be health-based, so we don't want any limits or anything. If people need the work done, we want them to get the work done. We want to pay the professionals involved properly. That includes dentists, dental hygienists, denturists, and dental assistants. And we want efficient administration. And the reason those pieces are critical is if you look at the history of public dental care in this country, over the last 100 years, various provinces have at times brought in various forms of means-tested dental care programs, and invariably they fail. And the reason they fail is because they violate one of those things. They either have substandard fee schedules, so dentists don't want to do the work. They have crappy fee guides, so that it really doesn't do the work that people need. There's limits, and eventually it withers. And of course, when governments get in fiscal problems, what's the first thing they cut? Is they cut services to poor people. So I do not want this to be a poor person's plan. I want this to be a normal plan, just like I have or anybody else has through work. And I want to see 9 million Canadians carry dental insurance so that they can go to the dentist and the dental hygienist and denturist and get the work they need done like everybody else in this country. And then we won't stop working there. We're going to keep working, hopefully when we get an NDP government, and we'll fold that into our public healthcare system.
Thank you, Don. So I'm just going to go to the Q&A where there's a number of people who have posted comments and questions. Somebody who's asking about water fluoridation. Is there any plan or any, sort of vision to introduce fluoridation? I live in Montreal where there is no fluoride in the water. It goes back to Jean Drapeau and some superstitious Catholic stuff, I think. But and then people who are inquiring about dental care for the disabled, and whether or not there's any kind of special provision for people who are on disability insurance or live with a disability. And then somebody asking about privatization. Now we see aggressive moves to privatize large parts of the public healthcare system. What are the chances that dental care and dental health care could be affected by this general backdrop of a push toward privatization? So let's try addressing those three. I'm going to try and bundle the questions if I can, to use a telecom term. So Brandon, do you want to tackle the fluoridation thing and the disability access issue?
Sure. So basically, community water fluoridation is beneficial to reducing dental caries in the population by about 25 to 30%. Very helpful, very cost effective. Yeah. So for every $1 spent on community water fluoridation, we tend to save about $25, I believe, or so in untreated dental decay in the population, or dental decay that no longer needs to be treated. So it's very beneficial. That's not tied to the Canadian Dental Care Plan. I think it's something we absolutely need to push for and have more widespread. But it's not something, it's a separate issue that we need to be working towards.
So Brandon, there's a comment here saying, good luck on fluoridation, not in this political climate. No party would risk it. Maybe you could just quickly comment on that, and then on the question of access to dental care for the disabled.
Sure. So there's a lot of outspoken people who are very against water fluoridation for various reasons that are largely, in my mind, conspiracy theories. They're not grounded in reality. There are examples in history of people having too much fluoride in the water for various reasons that are like 1,000 times higher than you would actually see in any sort of developed country when they fluoridate the water. So, it's a problem that's quite easily brought under control. And it is very beneficial to the population. As far as treatment for people with disabilities, it is really important that we look at alternative dental delivery models for these populations, because it does take longer to treat these people on average, which means the economics for dental providers are different. You could imagine if you're able to do 10 fillings in a day, in one population, and another population, because it takes longer to treat these people, maybe you're only able to do 5 fillings. It's going to be much harder to sustain a practice. And one of my concerns with the Canadian Dental Care Plan, where it's an insurance-based program, it will be harder for dental providers to set up clinics fully geared around these populations. It will obviously help them, but it will still be harder for those people to access care than the general population writ large, because it takes more time to treat these people. And I hope with time we're able to look at having more salaried dental providers that, they're more insulated from these market forces. They don't have to worry about churning out so many patients in the run of a day. I do think that there's an interesting component with the Oral Health Access Fund, which basically has about $75 million per year once the Canadian Dental Care Plan is up and running, to help communities that struggle to access care through private practice dental clinics. From my understanding from talking with Health Canada and the Access Fund team, basically, they're not necessarily looking, from my understanding, at having a public dental sector that they're going to fund and build. More so, I think they're looking at trying to help kickstart private dental clinics that can sustain themselves in some of these non-traditional dental settings. So say bringing dental providers into settings like long-term care settings, to rural communities that might not have the dental workforce to meet the population needs, as well as maybe clinics that are specifically geared towards people with disabilities as well. I'd be interested to get your thoughts on the Oral Health Access Fund, Don, as well.
So Don, just before we cut away to you, I just wanted to throw in a few more questions. Somebody who says, bonjour tout le monde et merci pour cet événement. This is a friend of ours. This is Olivier Surprenant in Montreal with l'Union des Consommateurs. What do you think of the lobbies that are currently working against something as obviously necessary as public universal dental care? So I'm going to add that to the bundle of questions, but I'm going to throw to you, Don, in answer to Brandon's query.
Sure. Well, let me tell you that when we first were able to secure this agreement with the Liberals, and let's face it, I think people were shocked, because there had not really been a lot of work done on expanding dental care to this degree. This represents the single largest expansion of publicly funded healthcare in 50 years. There had been a lot of work done on pharmacare, but
just a second. I just want to underline that. So that is like a major achievement, Don. That you this is like a big step forward in a context where there's generally quite a lot of hostility towards expansion of these programs. That's something to cheer about, right?
I think it is, and people sometimes ask me, like, why are we propping up Liberals? And I tell them, I got 9 million reasons. And I'll tell you, I've been in parliaments where it's hard to look back and think what was really accomplished. If we do one thing in this parliament, if we can make sure 9 million people who don't have dental insurance, as a result of the work that people like Brandon and you all have done, and I want to give credit to all the stakeholders and people who have pushed for this and the Canadian public, that'll be a remarkable achievement. But I want to say that when that came out, what I realized was we were tapping into people who are hopeful for basically a renaissance in oral health. And that's really broad. I mean, just having a dental coverage is one thing, but, fluoridation for water, as was said, getting public health officials to go into schools. I mean, some of us can remember a long time ago when we were in schools, when you'd have a public health nurse or even people come in and check your eyes or check your teeth and in your schools. So catching kids young, having experimenting with the way we deliver dental care, like let's fund public community health clinics that are multi-disciplinary. And there's a whole bunch of there was great hope about that, and really want to be clear. Unfortunately, what we're doing here is quite narrow. We are trying to provide a normative dental care plan for people that don't have it now. But because of our advocacy of people like Brandon and others in the NDP, we did get this $250 million over 3 years starting in 2025 that is meant to respond to that. It's not enough to get it going, but the $250 million will maybe fund 5 or 6 pilot community clinics. It will start maybe doing some research into different ways of practicing. Maybe it'll help fund the training of more dental therapists, which I know Brandon has been a big champion of, which are almost like the nurse practitioner, someone between the dentist and the dental hygienist who, particularly in underserved communities, can actually do some simple procedures that don't really require a dentist, but are very important. I want to say about fluoridation, it's provincial, and it's not something, I actually am a fan of fluoridation. I believe the data is unbelievably clear that if we did put fluoride in water, we would make a significant difference in reducing dental caries in children across the country, but it's not a federal responsibility. I wanted to mention about disabilities. That's an astute observation by the listener, that we specifically singled out that we wanted dental care provided this year to seniors over 65, children under 18, and people living with disabilities. Now, what has become obvious to us is that people living with disabilities do not have equal access to dental services, even if they have coverage. Because, I mean, there's everything from people who are nonverbal to people that are in chairs to people who require sedation, general anesthesia, often which has to be done in hospitals. So I brought this to the attention. I've been fighting like heck to get the Liberal government to respond to that. And I've been arguing that in this dental care plan, we have to build into it things like extra units of care for people who need it. If I go to the dentist and get my teeth cleaned, I might just only need 2 units of cleaning. But if someone, like I said, is in one of those categories, they may need 6 units of cleaning. I'm also particularly worried about the crush of people who come into this program when it's established at the end of this year and early next year, who haven't been to the dentist by definition in many years. You're going to have people with great needs. So I want to make sure that I'll say one other thing. When I've pushed this idea of having pilot community health clinics. My suggestion is one in each region. One on the West Coast, one in the Prairies, one in Ontario, one in Quebec, one in Atlantic Canada, I guess 6, one in the North. And let's let all of these innovative oral health professionals in the country, academics and progressive practitioners, help design what those clinics look like. And they may have regional differences, but I think they should be built around a surgical unit that has anesthesia capabilities. Because we know that if there is a shortage of that, then why don't we make that the linchpin of a community clinic? So particularly with people with disabilities, know they can go there, they can get, and this is just for dental care, they can get the sedation and care and anesthesia that they need, and supplement that with the dental therapist and the dentist and the hygienist and the denturist, and maybe even other allied health professionals, maybe social workers. There could be other things that make sense. And I think we should experiment with that. Same thing with maybe the needs of rural Canadians, which I think it's a real problem. If you live in a rural area, sometimes you can have a dental plan, but you don't have access to care. I want to touch on privatization. All I'll say is that it's the single biggest threat to public health care in Canada, and it's based on myths. It's based on false information, and it's based on profit and self-interest. Let me tell you this: the cheapest, most effective, fairest way to deliver all healthcare is through a single-payer system. And that's not just me saying that. The data is reams of it. If you read only one document this year, go read the BC Court of Appeal decision in the Cambie Surgeries case, where it is a unbelievable takedown of anybody who might suggest that private care is a more effective or efficient way to deliver care. It's a lie. It's just not the case.
Yeah.
So
That's Justice Steeves of the BC court, whose decision was
yes,
upheld by the Supreme Court of Canada, and it is brutal. The language he uses, he talks about duplicative services being no good.
Anne, it's even better.
Yeah.
John Steeves wrote the original decision at the BC Supreme Court, and then it was appealed to the BC Court of Appeal, where it was 3-0 upholding it. And they did appeal the county surgeries bankrolled by the private healthcare industry in this country, appealed to the Supreme Court of Canada, who declined to hear it. So it is just like case closed on private delivery. So now the thing about dental care here is, let's not mix up private delivery with private pay.
And there's a question to that effect that I wanted to ask you, Don. Somebody saying that Sun Life has been brought in to be part of this. They got a contract to lay the groundwork for the dental insurance plan, and is that a source of concern?
On that it is. I'll just finish on private delivery. Is obviously dental offices and hygiene offices, generally they're delivering their services in a private manner. I agree with Brandon that it'd be nice to start reversing that and start making more options for professionals to practice in a public way. But I don't have a real problem with private delivery as long as it's single payer and it's paid for by government and everybody has equal access. But on the question of Sun Life, so the question when we had this, when we were designing this plan was, who's going to administer the benefits? Like, who's going to administer the claims? If I were the Minister of Health, I would have done it publicly. I would have had public administration, which is one of the 5 core principles of the Canada Health Act. That would have required the government to create within Health Canada a separate unit that basically processes health claims. Now, the federal government administers 4 dental plans, one for veterans and Canadian Forces, one for Indigenous Canadians, one for refugees and offenders, and another one for public servants.
Wait a minute, what about members of Parliament?
We're a public servant.
Oh, okay, sorry.
We're included in that. So
that would include Pierre Poilievre and the head of the bloc who voted against Dentalcare. I just want to mention.
Maybe some of us should be in the offenders category, but for now we're in the public servants. But all 4 of those plans, none of them are administered in-house. They're all administered by insurance companies that actually have the expertise. They've got the programs. They've got the claims experience. Now, as long as the federal government is making sure that there's appeal processes and that the claims processor is processing claims in an efficient and fair way, that's probably okay. Basically, the bottom line was the Liberals didn't think that they could create that in-house capacity that fast. And for my part, I was worried that they'd screw it up, like they screwed up the Phoenix pay system or others. And I don't want there to be a failure. I want this to be done right. We can always pull it in-house later on. So Sun Life there was a rigorous tendering process. They put out a tender to the complete Canadian public, invited all the insurance companies to apply. It was shortlisted down to 3. They then were shortlisted again, and Sun Life about 2 weeks ago was awarded the contract. And they'll be processing claims for a while. But it can always be brought in-house later on. It's not my druthers, but I think it'll be okay.
I just want to mention on the question of the decision by Justice Steeves, we posted that on our Twitter account. I will repost it because it is an incredibly articulate defense of public universal health care. And I wanted to also mention that Brandon Doucet's Twitter feed, the Coalition for Dental Care Twitter feed, is a very fun and informative Twitter feed, which I recommend people who can stand being on X, as it's now called, take a look at, because it's a real joy, actually. I commend Brandon and whoever else is working on that Twitter feed. So a lot of really interesting and detailed comments in the Q&A, like obviously people who know a lot about dental care, people who are, I think from the looks of it, a lot of frontline workers, people who know a lot of detail about dental disease. And somebody named Linda McEwen who says we need an upstream approach. Social determinants affect health and disease of mouth and dental oral disease. These things are preventable through diet and what she calls dirt control, refined sugars and carbohydrates, etc. So I wonder, is that what you're talking about, Brandon and And Don, when you talk about these different clinical sort of settings, this is an upstream approach that you're talking about. And I that's the number one thing. And then secondly, how can you bring a bunch of people who are who admittedly are not that interested in dental care into the tent on something like that? I mean, against the backdrop of, enormous pressure toward privatization. So I'm going to throw it to you, Brandon, then we'll go back to Don.
For sure. So there's different ways as far as looking at prevention for dental care in Canada. One of the big things that, from my understanding, Don, that the Canadian Dental Care Plan is looking to focus on is having fee parity with private dental plans, which means that people who rely on the Canadian Dental Care Plan will be they will be able to find a dental provider who's willing to do a cleaning much more readily than, say, people who rely on many of the existing public dental plans, where the fees the programs pay out may be half around what private plans pay, which obviously mean it's going to be harder to find a provider, which means, things like dental cleanings are going to be, things that get put on the chopping block, and people are going to focus resources more on dealing with pain and things like that. So having that fee parity is very important. I also think having those alternative dental delivery models is also very helpful as well, to make sure people don't just have access to dental insurance, but also having access to a dental provider willing to do the work. I think a good way of conceptualizing basically where we're going with the Canadian Dental Care Plan is basically, the ship's been going in the wrong direction. And it seems like with this minority parliament, there is a genuine effort to start steering this ship in a better direction. We shouldn't view this as our ultimate end goal, but rather a step in the right direction. And I do think one thing that's exciting to me is with the 2022 federal budget setting aside, I believe it was $5.4 billion over 5 years for the dental plan. The 2023 portion of the federal budget actually upped that to $13 billion, which means that there's a lot more money set aside to actually provide better dental coverage that has fee parity that's similar to existing private dental plans. And I also imagine that increase in funding is probably also a tacit acknowledgement that more people lacked access to dental care than they originally anticipated.
Did you want to jump in, Don?
Sure. Just on the fiscal stuff, we used to say in the Teamsters, talk is cheap, but money buys whiskey. At the end of the day, it's, how has the government put the money there? And as Brandon said, in budget 2023, we allocated $13 billion over 5 years, and then $4.4 billion ongoing every year after that. Now, I think that's low, to be honest. I think it's going to be more, but it gives you an idea that we just injected, billions of dollars into our healthcare system directed at oral health. But Linda was absolutely correct. I've been health critic for 8 years now, and there's 1,000 issues in health, there's 10,000 issues in healthcare, but some are foundational. And one of the most important ones is prevention. And that's why I think dental hygienists are such a critical component of this plan. They are really some of the most important prevention people. So things like in this plan, making sure that dental hygienists have units of coverage for oral health instruction, right? Teaching people why it's important to floss, how to floss. If people smoke, teaching people about diet, and like that's an important part of dental hygienists. But Lynn's absolutely right. I mean, if you pull a thread on a sweater, what we should be doing is working to keep healthy teeth, not just repair it once they've broken down, and that requires a whole different radical approach to how we deliver healthcare in this country, and we don't do it. By the way, we have a really good disease system. Like if you get sick or unhealthy, we can fix it. We don't do as good a job in preventing people from getting sick, and I think we see that in the healthcare system generally. I think it's a message I'm hearing very loudly and clearly about oral health. That I think as Brandon said, we're just getting started on this. I wanted just to mention lobbies. Someone said that earlier. This is a very big problem in this country. I'll tell you, on the pharmacare front, I have never seen a government, and that includes conservative governments, more in the pocket of big pharma than this Liberal government. And same thing with the insurance industry. And they're powerful, and they meet with them hundreds of times. Now, in this case here in dental care, we've had a little bit of an easier way because the insurance industry is okay because the processing of benefits is being done by private insurance company, and we don't have the big pharma sort of pushing. But I do think to the extent that that the professions are lobby groups, I mean that in a good sense, the dentists, the dental hygienists, etc. We've tried to involve them as much as possible, and that's why, as Brandon says, I want to make sure they're paid properly. One of the things I have proposed from the beginning that we model this plan on the NIHB just as a template. The NIHB is the plan that covers Indigenous Canadians. There's lots of problems with it, but it's got a broad basket of services. There's no co-pays, and it's kind of familiar with dental offices. And that plan pays about 90% on average, depends who you talk to, 85 to 90% of the provincial fee guides. Do you know in this country, the fee guides are set by the professions? Like, it's not like the doctors who negotiate a fee guide with the provinces. There's a give and take. The dentists in BC, they publish their own fee guide. So you can't just leave it to them because they get to set their own price. So, and we don't want to bankrupt this program, but the NIHB has worked pretty well by paying people about 90% of the fee guide in every province. The other reason that's good is each fee guide has got regional sensitivities to it. So the cost of setting up a dental office in Charlottetown is different than in, say, Chicoutimi, different in Montreal, different in Winnipeg, different in Edmonton or Red Deer or Vancouver. So these different fee guides sort of reflect that. And I think what we're looking at is to sort of come very close to the fee guide. My position, I don't mind telling you, 100% of fee guide is what my position has been. I want every professional. Why should a professional in any way be asked to work on this cohort and be paid any less than they would anybody else who walks in their office? And it's also a good reason to keep the professionals happy and providing the services that we need. So that's what I'm driving forward for.
Brandon, go ahead.
I think a good thing to add to that too is in the ideal world would actually force the provincial dental associations to negotiate the fees, because that's one of the reasons we see the cost of dental care rising faster than inflation. It's just the problem that happens is when you only scale back the fees for the public plans and not the private plans, you lead to discrimination against those patients. One of the concerns I have too is basically the federal dental plan, if it starts off strong, it's very exciting. And I think we need to kind of harness the success of this program as basically, why shouldn't we cover everyone under this program? Why don't we basically build off of this to do better? But also the political reality in this country is that, it might kind of take the winds out of the sail for future progress. And we might get governments in the future that are more hostile to public dental programs. And the targeted nature of the Canadian Dental Care Plan will lead to levels of resentment from people who pay into the program through their taxes but don't receive any benefits, which makes these programs more unstable in the long term and easier to erode. They can be eroded by, de-indexing the fees the programs come out from inflation, de-indexing the income cutoffs from inflation, and reducing the services covered in the future. And I do think that that's a really important part. Not just, we need to have universal dental care to make sure that everyone has access to dental care and to make sure, no one falls through the cracks in that sense, but also for the long-term political viability of the program. I do have concerns that over time that this program can be cut back, and, who's to say 30 years from now, if we don't end up, getting a universal dental plan, that we're not stuck in the same situation we are now, where, in 1980, we did not great, but we did much better than we do now at funding public dental programs. And we've kind of scaled that back as kind of austerity has kicked in. We need to try to create the political dynamics needed to prevent that from happening. I think universality, because everyone buys into the program, there's much broader backlash when there's cuts to the program that make it stand the test of time much better.
There are a lot of excellent comments in the Q&A, and I'm having difficulty navigating them. For example, somebody asking about coverage for dentures. Would that be covered under the new program for those people who have to deal with massive numbers of extractions? Somebody else making the point that hygienists are much easier and more quickly trained than dentists. So that would be an easy way to, advance at least preliminary care. And somebody else asking about eligibility. How do we, there is info on CDB access to outline eligibility. And right now, if you get any other benefit, you can't access the interim CDB. What could be done about that? So there's 3 more questions from our extremely well-informed and articulate attendees on this webinar. And I just wanted to mention in the chat, there's some information about the Canadian Health Coalition and other stuff linking you to our webpage and to our campaign on pharmacare and other work that we're doing, just for those people who aren't familiar with the CHC. So please do take a look at what's going on in the chat. And I also wanted to say hi to members of the board of the CHC who are with us tonight, and a number of people that are new to us. We're super thrilled to have such a good turnout. Okay, so back to the questions that I posed that I've already forgotten. Anyway, go to you, Don, because you have a good memory.
Well, I'm just really excited to maybe, for a change, offer a short answer. Dentures, yes, they'll be covered.
Good. Okay.
The enrollment process is being worked on right now. I did get a briefing on it. What I can tell you, I can't really go into details because it's not ironed out or public yet, but the enrollment will start by the end of this year, as our confidence and supply agreement calls for. And the insurance company that's been chosen right now, they were given some startup money because they have to hire staff. They have to get programs. We expect 4.5 million people to be going to the dentist, within the next 6 to 9 months. So it's a pretty big process to get them enrolled. And I just want to say a quick point about universality. Brandon's absolutely right. I want to just underscore again that universality is not just the moral and ethical thing to do, but it's also politically the most expedient, because that's why our healthcare system, try to take that away from Canadians, right? You can't do it because everybody has a stake in it. And so I think it's important that we don't stop after this, and we keep marching towards a universal healthcare, a dental care program as well, so that everybody has a stake in it. What I will say is this, the best way to keep this going, I hate to say this, hate to be partisan, but if Canadians want to have an expansion of our public healthcare system, they're going to have to vote for it. And the Conservatives have opposed our dental care program. So if they were to form government next time, who knows, they may try to roll this back. Now, I actually think I'm counting on Canada's seniors to save the day, because, if you think of the criteria, people who don't have dental care programs through work and who make under $90,000 a year, that's most seniors. And, when most seniors are going to the dentist next year, they, Pierre Poilievre would have to say to them, I'm taking away the taxpayer-funded dental care that they have, that he has. And, we've been paying to fix Pierre Poilievre's teeth and his children's teeth since he was 25 years old. And yet he would deny that basic primary healthcare delivery to Canada's seniors, who make a fraction of what he does. So, I really think we need to fiercely defend this program, and we need to not be content with it, but we have to continue the fight after that. And the last thing I'll tell you is, in terms of the enrolling thing, we're working that together, that if someone is covered by a provincial program now, that will not disentitle people from participating in this plan. We'll be coordinating benefits. I think the negotiations with the provinces going on right now, just about who's the first payer. So it's only if you have dental insurance provided through your employment that you qualify.
That is a really.
Go ahead, Brandon. I just want to mention we're coming up to the sort of planned end of our webinar. We were hoping to end at the top of the clock at around 8, but I'm gonna, maybe you could close off, Brandon, because somebody commended you and us as well, Don and you, for telling stories, the narrative around dental care, because a lot of people who have good teeth or have had access to dental care, they don't understand the importance of that. And both of you have done a great job of illuminating that. So let's go to you, Brandon, for your last comments, and then we'll give Don a last shot at it, and we'll say goodbye for now.
For sure. So just to add to what Don was saying, the 2023 portion of the Canadian Dental Care Plan would be that portion alone would be the largest investment in dental care in Canadian history. It will more than double the existing public dental insurance population. So it will be, if it comes to fruition, a massive step in the right direction. And I do think looking at the politics of this program is very important. And currently the Liberals have been polling quite poorly, which means they have to follow through with their promises to the NDP. Otherwise, there's going to be a Conservative government soon. So I do think that it's really important we look at these politics. We could see 4.5 million Canadians gaining access to the Canadian Dental Care Plan in the next few months, which is very exciting. I do have some concerns about the next portion of the federal dental plan. And, the Liberals in the kind of weaselly ways that they act, basically saying, we ran out of time. You have to vote for us in the next election if you want if you want the rest of the dental plan to be implemented. And I guess only time will tell, what we do about that. I would be interested to hear your guys' thoughts if we have time for that. But I do think it's a very exciting time. We need to try to harness the momentum to make sure it's not our end goal, but only a stepping stone towards, a more comprehensive plan. But the fact that we're even here having this conversation and talking about the Canadian Dental Care Plan is something that didn't really seem possible even a couple of years ago. So it's a very exciting time.
Agreed. And Don, did you want to say the last word?
Two things. In terms of stories, think of this. I talked about seniors. Let's talk about children. Tooth decay remains the most common yet preventable childhood chronic disease in Canada. It's the most common reason that children undergo day surgery, and it's the leading cause of why children miss school. So just think of this. We have kids who have such pain in their mouths that they can't go to school. This is a national shame, frankly, that a G7 country that has the wealth that we have cannot make sure that every single Canadian can go to the dentist and get their primary health care, oral health care needs. And, I think we all remember, I remember going to school in grade 7 or 8, the rich kids had braces, the rest of us didn't. You could see the kids who had good teeth.
Yeah.
This is a class issue. And where I'll end is this. Make no mistake. We would not be talking about this if the NDP hadn't driven it. Now, I'm not saying that because I'm tooting our own horn. It's a fact. People have to know that. The Liberals would not be doing this. They won't proceed with it unless there are New Democrats there. We're driving it forward. So that's the message I want to leave with people is if it's important to you, if it's important to your families, your neighbors, your coworkers, then vote for people who will expand, believe in our public health care system and expand it. And to me, dental care it's absolutely the next place we got to go in expanding our healthcare system.
So thank you et merci beaucoup à tous ceux et celles qui sont présents ce soir. Thank you very much to all of you who joined us tonight. Thank you to Tracy Glynn for stick handling the Zoom technology, and to Steve Staples, our policy director, as well as members of the board of the Canadian Health Coalition. And an especially warm thank you to Dr. Brandon Doucet, dentist extraordinaire, and to Don Davies, our friend on the Hill and health critic for the NDP. So something to smile about, no matter what your smile looks like. And once again, a great vote of thanks to everyone tonight. That's it for now. We're going to be doing more webinars. Hopefully the next one will be on pharmacare, Don. So stand by. And thanks again to Tracy for being such a good sport with the Zoom tech. Thanks, everybody. Take care.
Thanks to the coalition.
Don't forget to floss. Okay. Bye.